This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. Hopefully your day is going well, and hopefully you don't have back troubles. But if you do, we have the big three that I'm basically summarizing from Stuart McGill's back disorders book. The first one is called the curl up, and what it is, it's not a lot of movement. You put your hands behind your lower back, and you basically just flex and really contract tight through your abdominals. And you would hold between 7 and 8 seconds, and then release. The main reason for 7 to 8 seconds is it's proven if you do much more than that, it cuts off the oxygen supply to the muscles, so it's better off to do many sets of 7 to 8 second reps than one prolonged set. The second one would be a side bridge. This is somewhat of an advanced one where I'm putting all the weight on my forearm and elbow. I'm aligning my spine so I have a straight line from my head through my trunk, hips, and legs. You just want to avoid going too high or too low. So hopefully I'm pretty straight there. That would be a left side. Of course you would do it on the right to keep it even. Same rule, you would do 7 to 8 second holds, feeling those muscles work, trying to avoid any rotation like I was showing there, but you want to be straight the whole time. The third one and final would be getting on your hands and knees, having a straight line from the hips to the knees, shoulders to the elbow and wrist, and then basically just start with raising one arm up at a time, staying tight through the abdominals. Then you could move to one leg at a time, and then the more advanced one would be alternate arm and leg, and then return. The whole time you're keeping tight through the abdominals. So those big three are from Stuart McGill. They work really well. One trains the abdominals, one trains the side oblique abdominal muscles, and then that third one trains the low back. That is all protective for your lower back. Hopefully this helps. Please leave any comments or suggestions if you have any. Thank you. So here's the top 3 things that you can do or check for to see if you should come in for physical therapy or get your back checked out. Stand with your feet together, knees straight. You should be able to touch the floor with your fingertips, no pain, with good speed. A second thing you should be able to do, feet together, arms overhead. You should be able to have full extension. Hands should go well behind the heels. Hips should go out, no pain, good speed. The third thing, you should be able to do this equally, what we call functional no pain, to either side. Rotate trunk and hips. Rotate trunk and hips equally, symmetrically, no pain. You should be able to do those 3 activities: forward bend, backward bend, left and right rotation, no back pain or leg pain. If you do, you definitely want to go to a therapist that knows what they're doing, that's going to take a whole body look at yourself. If you want any more information, we're at www.pt-connections.com. You can call, stop by. We're in Pueblo Athletic Club, Pueblo, Colorado, and I hope that helps. Welcome to this weblog. This is Physical Therapy Connections. We're at pt-connections.com. I'm Chad Clark, and this one was an interesting article. It just came out in December 2014 on massage and anterior hip replacement. So we've been seeing a lot more people with the anterior hip replacement that's being done a lot around Colorado Springs here, but people live in Pueblo and they come here for rehab. So basically what it shows is if you do massage before and after the anterior hip replacement, even if you do it before and after the other types of options, the posterior lateral hip replacement, and those are the 2 main approaches that are really out there, that it shows to reduce scar tissue, reduce swelling, and basically just help you heal faster. We offer the massage, and we do see great results when it's combined with the physical therapy holistic approach that we take. But we thought that would be just something that you would like to know, or you could tell friends and family that massage with hip replacement before and after is a great way to speed up the healing. Welcome to this video blog. This is Chad Clark, Physical Therapy Connections. We're at pt-connections.com. And I want to give this real quick. In a recent survey, it was found that CrossFit athletes, basically 74% of them get injured during training. And 7% of those injuries require surgery. A lot of them are shoulder and knee surgeries, but there's with injuries, there's back and ankle and other body parts that are affected. So what I wanted to do is quickly again say that we offer functional movement screen. This is just what we use for part of the equipment, and it tests 7 main movement patterns. There's a couple clearing tests, 3 clearing tests to be exact, that look at shoulder and spine, and they clear just to see if you have pain. Because if there's pain, then more needs to be done to reduce pain and improve that body part. And then the functional movement screen consists of 7 main patterns. We kind of have our visual aids here to show what they are and different corrective exercises. But when there's, and I bring this up not to rip on CrossFit or anything like that, but we do see a lot more people that are getting injured with CrossFit and different types of high intensity training. And that's great to do. I mean, it works really well, it burns fat, it builds muscle, you know, all those good things. But if you don't have a good movement system in place in your own body, injuries are going to happen more sooner and they could be more severe. So you just want to be wary of that you want to definitely get functional movement screened. Usually within 1 to 3 sessions, you can have the screen, corrective exercises, and be on your way to being pain-free. And that'll eliminate pain, injury, and weakness. So welcome to this video blog. This is Chad Clark. We're at www.pt-connections. You can check out our website. We also have a lot of these videos on YouTube that give a lot of good advice each week. This one I wanted to point to the Journal of Conditioning and Strength and Conditioning Research, January 2015. We get this, there's 300 pages of information each month. This one had a couple good articles on the functional movement screen. And here in Pueblo, Colorado, what we are attempting to do, getting out there, and for mostly parents, grandparents, and even kids that may be watching this, we have a whole series of 7 basic movement patterns. This is just a pictorial representation of what we can provide. It's a whole body way of looking at how you can prevent injury and enhance your performance. So one, you want to get screened because people are not getting movement screened, and then when they get injuries, they're wondering, well, what happened? I'm a good athlete, I'm strong, I'm powerful, but movement screening will definitely show a lot. So it can actually predict injuries in ankles, knees, even in your spine and shoulders. So we would suggest a movement screening, and we have that available, and we see people all the time with that, and it's great because not only does it it can help you prevent injury, but it can also enhance your performance in the sports that you play. Check us out for more details. Hi, welcome to this video blog. This is Chad Clark. We're at www.pt-connections.com. We have lots of videos on YouTube. This I wanted to get to everyone, share with everyone. It's National Sleep Month in March. So March 2015 is approaching next week. And a few quick facts that basically you need to know: that you should get at least, as an adult, 7 to 9 hours of sleep per night. A great range to get that is between 10 p.m. and 6 a.m. Most of the physical repair of our bodies takes place between 10 p.m. and 2 a.m. Then the psychological and mental repair takes place between 2 a.m. and 6 a.m. So if your sleep is disrupted or you're just not sleeping during those times, you'll definitely be foggy, or you'll just not physically repair like you should. So if you're going through physical therapy or doing a strength training or a workout program and you're not getting the results you want, check into your sleep. The other thing that's very interesting is there's a lot of things lack of sleep are linked to, like depression is one, weight gain is the other. Because if you're not sleeping as much as you should, the hormone ghrelin, which you can think of as growling, ghrelin is similar sounding, will increase, which means you get more hungry and you'll tend to eat more if you're not sleeping. So another reason that if you're gaining weight and you're exercising, look into the sleep. That could be the key to why you're actually gaining weight, even though you're exercising and trying to eat better. So hopefully those facts helped, and have a good, happy sleep month. Hi, welcome to this video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. And this is a nice little diagram that was given to me by a patient. And basically it's how heavy is your head. So if you're in proper alignment, head weighs 10, 12 pounds, depending on the size of your overall body. Every 1 inch that it goes forward, you're basically gaining, or at least perceiving that you're gaining 10 pounds weight of your head. So like this diagram shows, if you're 2 inches forward, now your head weighs 32 pounds. If you're up to 3 inches forward from where you are supposed to be, it feels like your head would weigh 42 pounds, which could give you a lot of headaches and neck pain. So a lot of times just doing a simple chin tuck, or at least raising an arm overhead once in a while, especially if you sit at a desk, which a lot of people are what they call desk jockeys nowadays. You might want to get up and at least do a few realignment corrective exercises so the weight of your head isn't as heavy and it'll reduce your headaches. Hi, this is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. We're at www.pt-connections.com. And I wanted to tell everyone, if you're looking to get a massage, whether it's deep tissue, neuromuscular, we have Mike Coffey, which actually I'll point over here towards his credentials, where he has the Nationally Certified Therapeutic Massage and Bodywork. Now he's a certified medical massage practitioner. He also has the Neil Asher technique for frozen shoulder. So those are big diagnoses that come up, are basically back pain, frozen shoulder, any aches and pains. So whether you have your pain, injury, or weaknesses, come on in and get a massage. Usually you can get in within a day or two, but its slots do fill up fast. So I just want to let you know. So welcome to this video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. In this month's our Physical Therapy Journal, January 2015, there's a few basically don'ts. Don't use passive physical agents except when absolutely necessary to facilitate participation in an active program, meaning electrical stimulation and ultrasound that is typically used in physical therapy just doesn't work. And if it does, it's so short term, it almost makes it not worth it. You might as well use heat or ice at home on your own, just to let you know on that one. Don't prescribe underdose strength training program for older adults, meaning a lot of times the frequency, intensity, and duration is not enough. We tend to hold back because we think, oh, that person's a little older, we better not push it too much. Actually, they can take a lot more, and they almost need more in a safe and pain-free way to get the more muscle mass, to prevent falls, and just help them overall with their therapy. And then a few other ones, don't recommend bed rest following a deep vein thrombosis after the initiation of anticoagulation therapy, unless significant medical concerns are present. Basically, if someone has a clot in their leg, they're not recommending pure bed rest. They recommend some early activity and walking to keep that more healthy. Don't use continuous passive motion machines after surgery. We see that a lot. It doesn't really matter short or long term if someone used it after their knee or hip replacement. The passive motion machine, they need to just get more active, and that leads to better results. And then also, this last one we don't use here at all, but don't use Whirlpool for wound management. Basically, it just is not that effective. So if you have any of those, or you're doing, you might want to question that with the therapist, or if you've had it in the past, you might want to look those things up and find a better way. Hopefully that helps. So welcome to this video blog, Physical Therapy Connections. This is Chad Clark, and I wanted to, in the science department of the Master Trainer in February 2015, what it shows, new findings on saturated fat, is that you can eat even up to 30% of your diet or more of saturated fat, and you will not have any increase in heart disease or chronic disease risk. And in fact, what they're now showing with what's called the Mediterranean diet, which is a higher fat, lower type of carb, and moderate protein intake, is that within our cell there's genes, and that forms our DNA. And on the DNA, the chromosomes, there's what's called telomeres, and they're like little tails. The longer your telomeres are, basically the longer and healthier you'll live. And by eating a higher fat diet, you'll have longer telomeres, meaning you'll have a higher quality of life and less disease, and live your life better. So we wanted to get that out because there's a big scare of don't eat fat or I need a low fat diet. In fact, that's one of the worst things you can do. Welcome to this video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. And this, in February 2015, PT in Motion, it's our American Physical Therapy Association magazine that comes out monthly. Pretty much what it shows is pre and post ACL rehabilitation, shows benefits 2 years after surgery. So what that means is when you have an ACL tear and you're going to get surgery, if you do a couple visits of physical therapy before as well as after, you'll have a lot more strength and range of motion years later, so you can get back to all your sports and do what you want to do. Along the same lines is preoperative physical therapy visits, even 1 to 2 sessions before you have a hip or knee replacement, shows that you will save at least $1,200 after you had the surgery, because you'll need less home health. You won't have to go to skilled nursing facility as long. So we wanted to get that out there, that coming to physical therapy and doing some basic simple exercise each day before surgery will help not only reduce cost, but save you time and effort and get you healing better, faster. So we have a question that gets brought up to us a lot here at Physical Therapy Connections, and it is, what is physical therapy? So you probably have a lot of different definitions, but our definition here is it's a medical and health science that specializes in the rapid relief of pain, injury, and weakness. So there's no drugs, no surgeries, no invasive procedures, no side effects. It's all natural, and our patients love it because they get better faster. Another thing that gets brought up is what makes you different. A lot of people are going, well, we're the best, or we're better. But really better, everybody has their best thing that they're good at in their own therapy part of the world. So what we say is technically we're different. We do take a whole body approach. Maybe a lot of other people do as well. But we're after not only the short-term relief, but long-lasting pain relief from your pain, injury, or weakness that you come in for. As well as long as you don't aggravate what we help you get over and relieve, that it should last for a long time, basically forever. So hopefully that helps clear up a little bit about what physical therapy is. So last week I got this from a patient of ours in Time Magazine about your body, science of keeping it healthy. And it reminded me of basically by doing exercise, you'll keep muscle mass up, body fat down. And one thing that we have here is our body metrics. That is basically a way to measure bone, muscle, and fat thickness to see what your body fat is. If it's in a good parameter, or meaning low body fat percentage, you're probably going to age well and have good muscle strength, limit your ability or susceptibility of falling and all that, those kind of things. If you have a higher body fat and maybe a higher BMI, which is another common way to measure height and weight, then you might want to get that checked out and do something about it. So I wanted to just give a reminder that there is a body metrics. We can check that out. It's really inexpensive, and it's a good baseline measurement to see if your exercise is really doing you good and you're losing body fat. A quick tip, I was reading in our Journal of Orthopedic Sports Physical Therapy, November 2014, and it's all devoted to ankle problems and plantar fasciitis. So a lot of people will go see a podiatrist and typically will get a shoe insert or have a custom-made orthosis. It can sometimes be $300 to $400. A really quick thing that if you measure yourself and you keep your heel down and you go forward, the distance from where the knee is to the front toe with the heel down flap should be 4 to 5 inches. If it's any less than that, you probably have very severely restricted ankle, joint motion, maybe even calf muscle tightness. That would contribute a lot of times to plantar fasciitis because it has to work extra hard because you're not getting proper ankle motion when you're squatting or getting out of a chair or toilet or getting out of your car. So every time you're putting more strain on the plantar fascia, which can lead to plantar fasciitis. So a real simple thing is to test. If you have 4 to 5 inches on each side while keeping that heel flat, you have adequate motion. If you're still having pain, you might want to get that checked out by a physical therapist. So hopefully that helps. A little quick tip there. Thanks. Welcome to this video blog. I'm Chad Clark, Physical Therapy Connections, Pueblo, Colorado. In the November 2014 of Journal Strength and Conditioning Research, there's a great article that pretty much shows what we find with our wellness classes that we have by going 3 times a week as an elderly person, defined as, let's just say if over 60 years of age, if you work out 3 times a week, do a little bit of aerobic and resistance training, it'll help lower both the top and bottom number of your blood pressure. It'll raise the HDL, that good cholesterol, that is how it's defined simply, and then it'll raise your strength. So those are 4 parameters: lower blood pressure, raise your good cholesterol, and raise your strength level, which basically means you're going to be stronger, you'll put on a little bit of muscle, you'll lose some body fat, and you'll have a lower risk of heart disease, diabetes, and cancer. 3 times a week, about a half hour, even up to an hour if someone's really has the energy. That will help all those parameters. We offer those in our wellness classes that you can check out anytime by stopping by or even looking at our website. Thank you. Hello, welcome to this week's video blog. I wanted to, well, this is our new massage room. We've been remodeling, so for people that have been here, this hopefully creates a nice comforting atmosphere. Now, to show something that's not so comforting necessarily, is a person should be able to get all the way onto the ground and up. So briefly to show this, I should be able to go up, down. So people that are in a CrossFit, that's kind of like a burpee. We would add like a jump, and I would probably do it with a little better form. But you should be able to get up all the way onto the ground and back up in under 10 seconds. If it takes you longer than that, believe it or not, your risk of dying or having some severe problems or other things going on are much, much higher than it should be. Another thing that you can do that's not necessarily timed is if you are on the ground, let's say seated, you should be able to come up without touching anything else. The more points you have to touch, like an elbow or hand or anything to lift off, again, the more likely you are to have major problems. If you want to know what to do about that, definitely we have some ideas with our exercises, but you could also come in or at least find something out there that would strengthen you to be able to get on and off the ground much quicker. So hopefully that helps, and let us know what you think. Welcome to this week's video. This is Physical Therapy Connections. I'm Chad Clark, Pueblo, Colorado. And I receive this master trainer every couple months, so to give credit where I found this article, and it is in the Nutrients Journal. And basically what it boiled down to is they did a study with low-fat diet and low-carb diet, and who won over time, over about a year, was the low-carb diet. So unlike what we've been told for the last, 30, 40 years, that low-fat's the best, actually low-carb is better, and it showed people have higher HDL, the better cholesterol, so to speak. They had better ratios, their triglycerides were lower, the C-reactive protein, all these fancy things. Basically, they had less inflammation and better blood chemistry after eating a low-carb diet versus low-fat. So we thought that would be very pertinent, especially this time of year when everybody's worried about gaining weight, or maybe they don't worry, they're just going to gain weight over the holidays. Just think low carb options. It doesn't mean all meat or all fat diet. You're still going to eat fruits and vegetables. It just means that you might want to look into a little different way of eating so you don't gain as much weight. Hopefully that's helpful, and let us know what you think. So here's one really quick that you can do even before you get out of bed. I know usually we show things a lot standing in here. So a sitting one you could do right after you wake up. You just do a couple, pull your knee to chest with bent knee, pull from behind the knee, and then do some where you pull from in front of the knee, because there may be a difference. That quick little thing before you get out of bed each morning helps kind of lubricate the spine and get your hips mobile, and will make getting out of bed that much easier. Hopefully that helps you out. Welcome to this video blog. This is Chad Clark, Physical Therapy Connections in Pueblo, Colorado. And BenGreenfieldFitness.com had a nice article on basically the 5 mistakes of why you shouldn't sit. So I was going to go through those real quickly and give some pointers on it. Mistake number 1 is sitting at the gym. Basically when you use weight machines and you go to a gym and you sit, it's probably not a good idea because you've probably sat all day long. So to sit more is just adding more compression to your spine and probably not feeling good for your low back and neck and possibly shoulder. Number 2 is sitting on a bike. So it's kind of like with number 1. If you're already sitting a lot, sitting on a bike is probably going to just make things worse. In fact, I had a patient several years ago that sat all day at work for 8 hours, and then he would ride his bike for up to 8 hours a day, and then he would sleep for 8 hours. So he was pretty much not getting any weight bearing, and that led to some major problems like osteoporosis and weakening of the spine. Mistake number 3, exercising hard after sitting all day. You would think, well, that would be good, right? What it means is just by exercising hard for even up to an hour or 2 doesn't offset the bad of sitting for 8 to 9 hours if that's what you do on your job. So basically the best thing to do is if you sit a lot on your job, at least get up for a minute when you can, at least every hour, or preferably every 20 minutes, get up and at least do some type of extension or standing exercise. Mistake number 4, sitting on giant exercise balls. I think what he was basically saying with this, it's good to a degree, but it's not as good as what it's been made out to be. I know in our little office area, there's not enough room for chairs, so we've been sitting on the physio balls, but we only do it sparingly. So I think the key to that is, as long as you vary your position and you're not sitting on one too long, I'd say it's okay. You just don't want to do it all day. And then mistake number 5 says sitting on the toilet. And you'd say, well, how am I going to not do that? A lot of countries don't have a toilet. They basically have a hole in the ground. So to show you're going to do a full squat, which a lot of people say, there's no way I'm going to do that. What we do here is we have adjustable tables where little by little, we would have someone get used to squatting in a very limited range. As they get better, we would lower this down, usually an inch at a time, until they get to their maximum lowest height of squatting. That helps a lot of things like knees, hips, and really it helps you get things moving in your digestive system. So hopefully these 5 things about why not to sit helps you out. Thank you. Welcome to this video blog. I was reading through our American Physical Therapy Association, and it showed the 7 myths about physical therapy, and I definitely agree with all of them. Myth 1 is I need a referral to see a physical therapist. We get that a lot at our clinic, and actually you don't. Colorado is a very liberal direct access state. You can come in anytime and you don't have to see a physician prior. There's a few insurance plans you might have to check out where you have to see the doctor first, but most of the time you can come right in. It also says physical therapy is painful. Actually, our motto is safe and pain-free, so we don't believe in that at all. It should not be painful whether you've had surgery or not. It should be very mild and gentle. Myth number 3, physical therapy is only for injuries and accidents. Actually, we're doing a lot with wellness and preventative care, so hopefully you can prevent all, or at least most of the injuries. It's stated about 80% of orthopedic injuries can be prevented, and I do believe that, and we've seen that happen. 20% it's just going to happen no matter how great of a shape you happen to be in, but it definitely is. Physical therapy is not just for when you get injured. Number 4, any healthcare professional can perform physical therapy. That's just flat out false. You have to be licensed, and now, just like at our clinic, we have 2 people that are doctors of physical therapy. Myth number 5, physical therapy isn't covered by insurance. Actually, most of it is. About 90% of the people we see, it's covered by their insurance, and they pay what the contracted rate. There may be a copay or co-insurance that the patient or client would be responsible for. Number 6, surgery is my only option, and that's definitely false. They're showing more and more. The latest statistics are 30%, almost a third of all total knee replacements could and should be prevented. So we definitely see that help people avoid surgery. Myth number 7, I can do physical therapy myself. You could. We do find that the results definitely aren't the same, and something up or below the injury will probably get you sooner or later. So that's why we take a whole body approach, so we can not only treat what you're coming for, but prevent other things from happening. So hopefully that was helpful. Thank you. So in this video blog, I wanted to mention this article that was in the 2014 Medicine and Science and Sports and Exercise Journal. Basically, it stated the stronger you are, the less likely you are to develop diabetes, heart disease, cancer, things like that, all the big illnesses and disabilities and diseases in our society. It goes on to say that it's definitely an important modifiable risk factor, and we definitely find that in our wellness programs that we offer. Is the stronger people get, it increases their muscle strength, of course, lowers their body fat, increases muscle tone, and more importantly, they're able to get out of chairs easier, they can walk better, they get rid of their canes and walkers. So we always suggest doing wellness, at least trying it out once to see how that can help build up some strength and hopefully decrease your risk of disease. Thanks. So in this video, this Chad Clark Physical Therapy Connections, Pueblo, Colorado, I wanted to bring up an article I saw the other day on, by coming to physical therapy 1 to 2 pre-surgery or pre-operative visits, it will save approximately 29% of your time and money if you come to physical therapy before you have a surgery, especially like a total knee or total hip replacement. In dollar amounts, that is about $1,000 per patient by coming just 1 or 2 sessions prior to a total knee or total hip surgery. And we have a lot of very good strategies that are done safe and pain-free that you can do even for a few weeks prior to the surgery that will help you recover faster. So if you have any questions, definitely look us up or give us a call. Thank you. So welcome to this video blog. This is Chad Clark, Physical Therapy Connections. Try this maneuver. If you have any pain with it in your low back, you should probably get it checked out by a physical therapist or doctor. Basically, you keep your hips down, extend your elbows, raise your chest, and just see if you have any pain in the small of your back. That looks for what we call extension. And if you have any problems with that, let us know. It's Chad Clark, Physical Therapy Connections, Pueblo, Colorado. A quick screen you can do to see if you should get your back check or look at your back by a therapist or doctor is get on your hands and knees. See if you can do that first of all. Then rock back, heels to hips to heels, heels to hips, and then slide your arms forward. If you have any pain with that maneuver, you should probably get that checked out, and it'll help your low back pain. Thanks. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. Here's a quick screen that you can do to yourself to see if you should seek treatment for your shoulder problems. Yeah. Put your palm on the opposite shoulder, keep the palm down, raise your elbow as high as it'll go, each side. If there's pain on either side, you should get that checked out. Hopefully that helps. This is Chad Clark at Physical Therapy Connections in Pueblo, Colorado, and I have a quick little piece of advice that I kind of forgot until yesterday, and a patient reminded me that she had a total knee replacement, and what she was instructed to do by a friend who also had a total knee replacement is untuck the bottom covers, because what happens when the covers are tucked in bed, they're going to pull down on your foot, ankle, and that'll affect the knee. So one simple thing that may help you sleep better, whether you've had a total knee or not, but anything that's related to your foot or ankle pain or knee, even into your hip, if you try untucking or at least loosening up the covers down at the bottom of the bed or at the foot of the bed, that should help relieve some stress and pain and hopefully help you sleep better. If you do try this or you have tried it, please let us know by Facebook or email or come in or call. I'd be interested to see how that worked for you. Thank you. Welcome to this week's video blog. This is Chad Clark, Physical Therapy Connections in Pueblo, Colorado. And I just wanted to let everyone know we now have 3 of us here at this clinic. Adrian Gomez, Michael Flores, and myself that just attended level 1 and level 2 of the functional movement screen here in Denver this past weekend. And we'll get our certification. 2 to 3 people are already taking their tests. I'll do mine. We'll be certified level 1 and level 2. Basically, a functional movement screen is a great way to screen how well you move and make sure you don't have anything that could set you up for an injury. And if there is pain with those, I've been doing the selective functional movement assessment. Thank you. So welcome to this week's video blog. Chad Clark, Physical Therapy Connections, Pueblo, Colorado. Wanted to talk about a quick fitness tip that if you want a very efficient workout, what you can do, it's called a 30-30-30 workout. I got it from a new book by Ellington Darden, Body Fat Breakthrough. And if you take any exercise, machines, free weights, or your own body weight, for example, I was just going to use this for like a squatting exercise. You would start in the top phase and you would go super slow, taking 30 seconds to get all the way to the bottom, which I'm going faster than that, but just to show you. And once you're at the bottom, you're going to take 30 seconds to get back up, and then the third 30 will come in where you would lower again in 30 seconds, all the way to the bottom. So what that does, any exercise, you start at the top, lower down for 30 seconds, raise back up for 30, and then lower for 30. So it'll take a minute and a half. You don't even need any weight. They're great for body weight exercises, and they can really put on a lot of muscle even though you're not doing a lot of time, but the intensity is the key factor, and that's very high with these maneuvers. And just picking about a half dozen to 10 different exercises, doing it that method once or twice a week, eating properly, sleeping properly, and all that will add muscle and lose fat. If you have any questions, definitely visit us website www.pt-connections or stop by or call us. Thank you. Welcome
Welcome to this week's video blog. This is Chad Clark from Physical Therapy Connections, Pueblo, Colorado. And I wanted to highlight, I get this Master Trainer, which is a nice every other month little journal. And in the science department, there's a new sports medicine journal out this year, 2014, the effects of a low volume but high intensity training. And basically what it showed is by doing even as little as 12 minutes a week of fairly high intensity jogging, biking, or swimming, you can increase your cardiovascular system, heart and lungs, by 25%. So in 12 minutes a week over even in the first 6 weeks, so we're talking, that's 12 minutes times 6, 72 minutes, just over an hour over the course of 6 weeks. By doing high intensity training, you can improve your cardiovascular and heart and lungs a quarter. That could prevent possibly getting you off, that could take you off medicine. It could basically make you feel better and build a little bit of muscle, which would make you more metabolically active and promote fat loss. So I wanted to share that. That was one of the tips for the week. Do high intensity training, and you don't even have to do that much of it. If you have any questions, visit us at the www.pt-connections for our blog or our website. Thank you. So this is what we got from Gray Cook, to give him credit for what we copied. Functional movement systems. A lot of people that we see in physical therapy will come in with impairments and pain. So we want to look at your individual body parts, and we do what's called a selective functional movement assessment. That is a whole body head to toe exam to see where your pain is coming from. Because usually where your pain is, it's coming from somewhere else, either above or below the joint or muscle at issue. Then once you get past the pain and that's no longer an issue, it's great to do a functional movement screen, which is why I have kind of these devices out here. It consists of 7 main movement patterns to test your whole body as a functional unit. Then if you pass that, which is about 14 out of 21 or better, then you can get into other performance testing and eventually get into your skill training, whether that's weekend warrior, things you may do, running 5Ks, 10Ks, working in your yard, or if you're a more competitive athlete, your actual sport. So we wanted to show this because it's a good representation of where we see people, and you might come in anywhere along this whole hierarchy. The lower down that you would come in just means you have more pain and disability or dysfunction. Once you get more function and the pain goes away, you want to become more functionally oriented so this doesn't happen again. That leads into prevention and performance. So if you have any questions, we're Physical Therapy Connections, the www.pt-connections.com, and you can email us, call, stop by, check out our website, and see how you can improve your function. Thank you. Welcome to this video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. And what I wanted to state this week, it's prevalent everywhere, back pain, especially lower back pain. I believe 80% of all people will have it, and it can last for a long time. One thing that can work really well is stabilization, meaning where you contract your abdominal muscles to stabilize the back. One simple thing that can be done, I won't say easy, but simple, is you can get on your hands and knees. If you have wrist problems, you could use a fist. Make sure something padded. And then what you would do is you would raise one limb at a time. We usually start with the arms. If you want something a little bit tougher, you would raise the leg to full extension, return. What I'm trying to do is keep my back pretty much like a table. I don't want to twist or turn or lose my stability back there. And then if you want the more of a challenge, you would raise opposite arm and leg, bring it back down, and then do that between 5 to 10 times each way. That'll give your back a good workout. You'll build up the endurance and stabilization and hopefully prevent back pain. And if you already have it, it can help you get out of the pain. Thank you. Welcome to this week's video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. And I want to show you 3 quick movements you can do for shoulder, neck, even shoulder blade pain that you can do anywhere, even in your office, home, or work. One would be a whole body arm swing where the opposite leg would be in front of the arm you're swinging. So I have my left leg in front, right arm. You'd swing about 10 times that way, then switch. Now
you would do a whole body swing, right leg forward, left arm. That would be a front and back movement. That'll help you reach higher this way. Then the second one would be a side to side pendulum. Some people call it like a golf swing. I know it's not exactly like golf, but it kind of looks like that. This starts to open up some of the tightness that we get with in our chest and abdominals by sitting a lot. The third and final one addresses a rotational movement. So I'm reaching across that forward leg, which happens to be the opposite of the arm I'm reaching with. And then I would switch and pull all the way through. As you gain more and more flexibility, you would reach further and further away from the body and closer to the ground and further out. So those are 3 quick things you can do for shoulder, neck, shoulder blade pain, and kind of loosens you up. If you have any questions, please visit us at www.pt-connections.com. Hi, welcome to this week's video blog. This is Chad Clark, Pueblo, Colorado, Physical Therapy Connections. I thought we'd go all the way back, developmental sequence-wise, to like as we were babies. So we have this thing where we call it rolling, where it's either initiated with the upper body or the lower body. So there's 8 ways you can do this. One is I'm keeping my lower body still. I'm only using my trunk and arms to roll from my back to my front. And then now I'm going to do that from my front to back. And I can do that both left and right sides. And that's 4 ways to use the upper body to roll. The other 4 with the lower body would be my leg would initiate the movement. I'll roll over, and now my leg's going to initiate as I roll left to right. And now I'm going to go from right to left. So the trick is when you're using your upper body, try not to use your lower body at all. When you're doing the lower body rolls, try not to use the upper body. It's a lot tougher than it looks, but it can really develop core training. Give it a try and comment on it and see what you think. Thanks. Hi, welcome to this video blog. This is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. And we wanted to show you a couple quick things you could do while at work or just sitting at school or just when you're sitting, maybe watching TV or reading. You'd want to check to see how much rotation you have, both inward at the hip and outward at the hip. And if you see that you're limited, or hopefully it's not painful. If it is, you want to keep in a pain-free range. But if you find that, wow, I'm kind of tight there, and maybe you're tight on both sides, you could do something simple where you'd cross the leg and allow this knee to kind of fall inward. So you're stretching the outside part of the hip each way. If that's too much, cross-legged, you could just use your opposite hand. What that does is so many people get very tight internal rotation of their hips, and that starts to affect hip arthritis and even hip pain. So that's a quick one that you could do. Of course, the opposite, if you're tight this way, would be crossing the leg, pushing down on the thigh to stretch that way. And really, in here we do a lot of movement stretches, so you don't really have to hold for very long. Just a few seconds, and repeat that about 5 times each leg. That'll help restore some hip mobility and even improve back pain. Thank you. So welcome to this video blog. This is Chad Clark, Physical Therapy Connections. I'm going to show a few quick movements you could do right out of bed or before you get out of bed each morning. One would be a straight leg raise actively, where you would raise up, keeping your knees straight, foot neutral position, and basically you should be able to have your leg straight up and down. If not, it's really tight, you would work on maybe using a towel to help raise your leg up to stretch the back of the leg and hamstrings. Another quick one you could do is there's 2 ways to do this, where you would pull your knee to chest in front of the knee. Now some people have knee problems, so this becomes very difficult, and all you would do is pull from behind the knee, and you would do about 5 to 10 each way on each leg. And pretty much with that, the straight leg one will stretch out the hamstring. The bent knee will stretch out the hip joint, where a lot of people get tight, and it's a great thing to do even before you get out of bed. Thank you. Hi, welcome to this video blog. This week I wanted to touch upon some things that were in our physical therapy journal related to Pilates, and really not talk about Pilates because we don't technically do Pilates here. But a lot of the research is showing that the consensus among a lot of clinicians, whether they're physical therapists or Pilates only type of practitioners,
that it's all about body awareness, breathing, movement control, working on your posture, strength, balance, flexibility, and endurance. All the things that we do here each and every day from a whole body, three-dimensional approach. It's just nice to show that the literature, even though it talked about doing Pilates exercises, but all the qualities and issues that people related to their chronic low back pain, or really any body part for that matter, it's all about looking at core stability, their balance, and then educating them on how to do it in a safe and pain-free way. So that's pretty much what we can provide here at Physical Therapy Connections, and it shows in the literature. It's right up there with what people that are now doing with Pilates, and you don't need any equipment, which is really nice. Like always, definitely visit us at our website, the www.pt-connections.com, or Facebook, Twitter, YouTube videos we put out every week, or stop by. Thank you very much.